Hi, good afternoon, everyone, and welcome to our presentation on the county's investment of the settlement proceeds that we are receiving as a result of the opiate epidemic lawsuit settlement that recently occurred. I want to thank everyone for being here. We're also thanked by Jennifer from Deaf Access Services for providing the American Sign Language here. Today I'm joined also by a number of commissioners and our partners in county government, including the Health Commissioner, Dr. Gail Burstein, our Social Services Commissioner, Marie Cannon, our Probation Commissioner, Michelle Ozawi, our Acting County Attorney, Jeremy Toth, as well as the coordinator of our Opiate Task Force, Cheryl Moore, who've all been instrumental in setting up this plan, as well as our Policy Director, Brian Bray, and our Deputy Budget Director, Ben Swanenkamp. We have a lot of people here because we're talking about a big investment that the county will be making over the next few years. Just to give you a little background, kind of a reminder of where we were, that irresponsible practices by the pharmaceutical industry resulted in significant number of deaths and incalculable harm to families across Erie County. Between 2012 and 2021, more than 2,000 Erie County residents have died from an opioid-related overdose. Our response is considered a model nationwide for how communities should be battling the opiate epidemic, but unfortunately we know that after 3 years of declining deaths, that the deaths increased in 2020 and 2021. And here is a breakdown in a graph form to show you the deaths actually that are attributable to an opiate overdose between 2012 and 2022. We have 62 confirmed cases right now for 2022, and 108 are pending. We do anticipate that a good portion of those pending will actually result in a confirmation of an opiate overdose death. And then, of course, there are others who are out living their lives right now, not even thinking about it, and will probably end up dying in our community as a result of an opiate overdose. It's a little different than it was in the past. It's not exactly the same as it was with individuals who are becoming addicted to opiate prescription drugs, and that's why we have the settlement. There's a lot of different factors going on out there, including overdoses related to cocaine that spiked with fentanyl. Fentanyl's in many different products, including fake prescription drugs that people are trying to buy on the streets. Unfortunately, there's been recent deaths, including, I was just advised by Cheryl Moore today, of 2 individuals who died right next to each other from what appears to have been a fentanyl spiked cocaine overdose, where they both took cocaine at the same time and died because the cocaine was spiked with fentanyl. So a little background on the lawsuit. In February of 2017, Erie County was one of the first counties in the United States to file a lawsuit against pharmaceutical companies and distributors for the harm they caused by creating the opiate epidemic, by creating these pills that they knew were addictive or knew were harmful but said they were safe, and pushed them out in the market. Recently, a national settlement of all those lawsuits was entered into by most of the major pharmaceutical companies and the distributors. And as a result of the settlement of the lawsuit, Erie County is scheduled to receive a total of over $63 million by 2038. Now, there are restrictions on some of those dollars, and the largest proportion of those dollars are actually being received in the first year alone. In 2022, we are anticipating receiving over $19 million, of which some of it is directly coming to the county and is restricted, which means it can only be used for addressing the opiate and mental health crises. Some of it's unrestricted. And then there's also additional money that we're receiving from the Attorney General as part of New York's settlement, which is once again restricted and unrestricted. We do not have at this time received $19 million. We have a little less than $4 million that has been received as of this moment, though we expect by the end of the year that we will receive upwards and over of $19 million in the settlement. And then between 2023 and 2038, we'll receive additional funds, pretty much a standard amount. on an annual basis, and that amount itself is $44 million. That'll be received between 23 and 38. And once again, there's direct dollars that come from the pharmaceutical settlement to the county, others that go to the Attorney General's office and then come to Erie County. While I mentioned the Attorney General's office, I want to thank Attorney General Letitia James and her team for the hard work that they did to pursue the opioid settlement on their part. They made really tremendous attempts for quite some time, working with us and others to ensure that the manufacturers and distributors were held accountable, and I want to thank her and her team for the work that they did and how we'll be receiving additional dollars as a result of their efforts. So now, there's a lot of stuff that this is going for. We're not spending all the money, of course, up front. We are going to be sending over various resolutions to the legislature as money comes in for various positions and programs that we will be implementing as a result of the settlement dollars. And I want people to understand, this is not our local tax dollars that is funding these positions. This is actually the money that is received in the lawsuit settlement from the pharmaceutical companies and the distributors. So this is not tax dollars, but this is actually dollars that are being received from the pharmaceutical companies and the distributors as a result of the pain that they caused. So there's a number of grants that unfortunately are ending soon that we're already doing this work in, including an opiate stimulant and substance abuse program grant with 2 peer navigators, county hub and spoke empowerment grants, Noxalone expansion and emergency department care coordination grant. These grants are existing but are going to end, so we're going to use part of our initial proceeds to ensure that these positions continue. They're very useful in making a difference and helping to save lives. There's also an opioid response initiative in the probation department with a probation officer and 2 peer navigators that will be continuing using the funds that we have right now received. Then there's new county positions that'll be funded by the settlement in the health department, a family services coordinator, peer navigator, data manager, chief account clerk, needed to ensure that these programs are run properly. In social services, there will be a counsel, a new legal counsel that will handle cases in family court where children, parents, and families are involved and involve substance abuse issues. Employment counselor, caseworker, community resource technician in the social services department. There will also be a new probation peer navigator, 2 positions that will be added to provide outreach and services to those that are at-risk probationers and their families. So these are new positions that will be going into effect once this plan is fully implemented and approved by the legislature. There's new strategies that are being put in place with additional funding that we'll be receiving. It says OASAS, that's the Office of Alcohol and Substance Abuse Services for New York State. And a new anti-opiate media campaign, a harm reduction program will be continuing and even strengthening. Peace Prints, we'll be working with Peace Prints to do a reentry program, mobile narcotic treatment programs, expansion of housing programs for individuals with substance use disorders. There's an immigrant and refugee community engagement to ensure that those communities that often aren't touched as they should are reached out to and they understand the issues that deal with substance abuse. We want to assist pregnant women with substance use disorders, which unfortunately there are in our community, and we want to help them get through their pregnancy by overcoming their substance abuse issue as well as ensuring their baby is safe. And then we're going to have an open request for proposals for $6 million from various organizations on what they consider to be the best thing that we can see in our community for use of these dollars. So this is everything I just talked about, but in a little greater detail. You can find this PowerPoint presentation will be available online, and we'll be giving you information. So for those who want to delve into it in greater detail, rather than the fast pace I'm going right now, you can go through and figure out more about what's happening. But we're going to get another $1 million plus from the state and OASIS funding for addiction services. That's a 5-year commitment. We are putting that in various organizations across our community on an annual basis. everything from Best Self, Casanova Recovery, EPIC, Mid-Erie, Native American Community Services, to Westside Community Services. Lots of organizations are going to be receiving additional funding to help them address the problems of substance use disorders in our community. We're going to do an anti-opiate messaging campaign. It'll be run and funded through the Department of Health. It's going to be a multi-year media campaign to help tell the stories of people whose lives have been impacted by opiates. Some of them are family members who lost loved ones. Others are those who actually went through and overcame a substance abuse addiction. So that's a very, very important media campaign you'll be seeing a lot more for in the future with a one-time cost of $1 million. Harm reduction campaign through the Department of Health and the Office of Sheriff's Correctional Health to set up ways in which we can reduce the results that often occur from an opiate overdose, and to help individuals that are recently incarcerated and others that are actually in jail overcome their addictions. This is a $500,000 program for now, and then we'll be working with Correctional Health and the Health Department to purchase Narcan and other harm reduction supplies, including test kits, syringes, alcohol wipes, HIV info, and what is the HIV, Cheryl?
HIV/AIDS testing.
AIDS testing, okay. Wasn't certain on that one. So we have a program associated with harm reduction to reduce the chance of an individual overdosing. Especially associated with that is the test kits to ensure that if there's cocaine or other substances that may be spiked with fentanyl, people find out before they actually ingest it. We're working with Peace Prince, as I noted, on a reentry program of $500,000 to help individuals that are coming out of incarceration move on with their life. Many of those individuals have substance abuse problems. Sometimes they get taken care of in jail, but then when they get out, they can fall right back into it. So we'll be doing a program with Peace Prince. The Mobile Narcotic Treatment Program through the Department of Health, working with a number of agencies to ensure that we're out in the street, so to speak. We're not just people are waiting for people to come to us, but we're out in the community where, unfortunately, there often is a drug issue. We know where these are. And we have people that go out there, including peer navigators, but we want to push that up to a higher level with regards to a mobile narcotic treatment program in which we'll be working with Best Self Behavioral Health and Promesa. Housing programs for individuals with substance use disorders. This will be through the Department of Mental Health. There's two organizations, Rebecca Rose Recovery House and Group Ministries, that will be receiving funding from Erie County to expand their programs for individuals with substance use disorders. We know one of the biggest problems for someone with substance use disorder often is housing, and we want to ensure that individuals have safe housing and they can get the services and treatment that they need. The immigrant and refugee community, the Department of Health will be administering a program with various agencies to train members of the immigrant and refugee communities so that if they're unfamiliar with substance use issues, that they understand what they are and that they can contact us to help them get the help for their families. To assist pregnant women with substance use disorders. As I said, this is an issue that does exist in our community. The Department of Health will be working with our partners in the medical community to assist individuals who may have a substance use disorder, an issue at the same time that they're pregnant. We want to definitely help that mother get over her addiction and make sure that that baby is born healthy. $120,000 in the first round, but it is an indeterminate amount of line. And we expect this to continue on an annual basis. We have a number of additional incentives that we're not going to go into great detail here. But one of the things I want to talk about is an open request for proposal. The task force will issue a request for proposal to fund initiatives totaling $6 million. So we're soliciting proposals on ways to address the public health crisis from third-party agencies. As we know, our task force began in 2014. As a result of the executive order that I issued with regards to the public health crisis that we were dealing with, and it still exists today. I know we haven't talked a whole lot about it in recent press conferences. Spent a lot of time here talking about health and issues associated with the pandemic, but we didn't talk a whole lot about opiates lately, even though we know it's still an issue out there, and the task force has been working very hard. So the task force will issue the RFP, they will review recommendations that come in, and we'll be making allocations out of the $6 million for this open request for proposal. Substance use disorder is a chronic disease of the brain. Help is available. You are not alone. This is a disease. We've talked about this before, and help is available to get over your disease. We certainly are continuing the Crisis Services Addiction Hotline. That is still in existence, 716-831-7007. We have our media campaigns. These are billboards that you often saw along the side of the road, whether it's a crisis service hotline or don't trust your cocaine, because we know cocaine is being spiked with fentanyl and too many people are dying of overdoses who say they don't have a drug problem, but they use cocaine recreationally and they die of an overdose because their cocaine is spiked with fentanyl. So they should always carry Narcan, and they should never ingest alone. And as Cheryl Moore will say, if you are with other people, please don't do it at the same time, because as we saw recently with the 2 deaths, where 2 people ingested cocaine at the same time that was spiked with fentanyl, they both died. And that is a very sad fact that occurred recently in our community. Narcan, we give free Narcan. We train it. We continue to offer that through the health department, and you can text for Narcan, and we will deliver it. You can text 225-5473. That's 716-225-5473. The Department of Health will respond and get you free Narcan, no questions asked. We want it in the hands of our residents so that they're not statistics of our medical examiner's office when it comes to increasing deaths. This is a very comprehensive plan. As I said, the overall amount will be over $63 million through 2038. We are sending over a resolution to the legislature to authorize spending of $10.7 million of the settlement funds. We're certainly not seeking authorization for funds we will not receive for future years. He said we're expecting $19 million to come in this year, and we're sending a resolution over for $10.7 million this year, which will also include the $6 million for the RFP that we just talked about through the task force. The work that we're doing and the investments we are making with these dollars that we receive from the pharmaceutical companies and distributors will save 9 jobs that unfortunately would have had to been cut as a result of a loss of grant funding, and we're adding 10 more positions to directly address the opiate crisis in our community. We're going to continue to issue Narcan and other products out there, test strips, to ensure that people are safe, and if they unfortunately have an overdose, that someone can save them. We're putting in a lot of money over the next few years to invest in our community to protect our public from the scourge of the opiate epidemic. It's as simple as that. We understand that it is still an issue. I'm very thankful for our legal teams that worked very hard for a number of years on the lawsuit and the settlement that we received. $63 million is a lot of money, but it is through 2038. We are anticipating $19 million this year. We only have received $4 million so far, and the proposal that we're sending over to the legislature is for a $10.7 million investment this year, and we'll send over additional proposals as the money comes in from the settlement proceeds. And our goal is to save as many lives. That's as simple as that. We are investing this money back into the programs that we know that work. We have a system that works. We were reducing the number of deaths on an annual basis. We had 3 years in a row in which deaths were reduced in 17, 18, and 19, and then unfortunately deaths increased during the pandemic in 20 and 21. We know our programs work. We're going to expand on it so that we can save more lives in our community. And that's the goal. And that's why everyone's here today, to make a difference, to save lives in our community and to give people a better life than they may have right now if they're addicted to an opiate drug or they use another drug that happens to be spiked with an opiate. With that, I'll open up to any questions.
How sustainable are all these programs? You get a third of the money kind of up front, and then how do you stretch that out over forever, how long you need it?
Well, we're getting a third of the money up front, but we're not planning on investing all that $19 million in 1 year. We're going to save some of that for future years. We're putting it in a segregated account, which can only be used for the opiate issue. So while we're expecting $19 million to be received this year, we're not planning on spending $19 million. We're going to spread it out over future years so that we have this for the foreseeable future, and that we can continue these investments for the next 15 years.
What would you like the folks of Erie County to know what this money's gonna do, how it's gonna help them?
Well, I truly hope that this will really save lives. We're going to invest it back into the services that we know that works. And we're going to put it in programs and third-party providers that are out on the street dealing with this every day. So I want people to understand that this money that is coming in from this very important settlement is not going to be wasted. It's not going out there and it's going to be spent on parks or roads or libraries, which are all very good programs, but it's a settlement with regards to the opiate epidemic. It's being paid for by the pharmaceutical companies and the distributors, and we're going to put it back into the programs to help those that are in need who may be suffering from an addiction or have a family member who's addicted. They said that inevitably multiple people who are alive today are going to be dead by the end of the year because of an opiate overdose. And it's not the old school opiate overdoses. It's not necessarily individuals who were hooked on a prescription drug who then migrated to heroin. It could be an individual who's recreational user and which might be once or twice a year and gets cocaine that's spiked with fentanyl and dies. We also are hearing repeated stories of fake prescription drugs that are being bought on the street. People think it's Xanax, people think it's something else, and it turns out it's fentanyl, and they die. There's actually a story I passed on to Dr. Burstein recently about deaths at two college students in Ohio who thought that they were taking a drug to basically keep them up all night so that they could study for their exams, and it was fentanyl, and they died. That unfortunately is what's going on in our country today. And we need to be able to get this money out into the services that we know will save lives. Andrew.
I apologize if these questions have already been answered, but what are the latest numbers in terms of suspected and confirmed opioid overdose deaths so far for this year? And my other question was, of the initial money that's coming through that you're sending, there it is, the money that you will have available to spend and that you're asking to be allocated by the legislature, where is that money going?
Sure. As it shows on the chart, there are 62 confirmed opiate overdose deaths through July 7th, with 108 cases that are pending. Those probably not all will be confirmed as opiate overdose deaths, but wouldn't be surprised if a good portion of them are. It's always sad to see these numbers, especially after we were seeing reductions in 2017, 18, and 19, to see the increases in 20 and 21. And knowing it's changed, it's not the same as it was. These are different individuals who are, if not becoming addicted, are dying because of their ingestion of drugs, whether it's a fake prescription drug, whether it's cocaine that's spiked, or it's the traditional old school that we saw. There are people that are dying and are going to die and continue to die because of this opiate scourge in our country. It's just not a region, it's our country. We can give you a greater breakdown of the $10 million in the resolution, of which $6 million of it is the RFP that will be reviewed by the Erie County Opiate Task Force, and then the $4 million is primarily at this point to address what would have been shortfalls as a result of loss of grants. But we can get that to you on a more individualized basis. I want to thank my team for being here. They've worked hard to put this together. This was not an easy program to put together. We're working with our third-party partners to ensure that we're trying to save as many lives as possible. So I want to thank the commissioners and others and their staff who really worked hard to put together a very comprehensive plan. As we said, Erie County is considered a national model to respond to the opiate epidemic. And we have to change as the response as what we're dealing with is changing. So our response is changing, and these additional dollars that we'll be receiving as a result of the settlement of the opiate epidemic, paid for by the pharmaceutical companies and the distributors who peddled those drugs, is going to make a difference in saving lives. And you'll be seeing a lot more about this as we move along, including when we get into the media campaign. You'll be seeing a lot more about this on television and on the streets when you see the billboards and the other information, so people understand that while we had hoped that the scourge of the opiate epidemic was waning and we would not have to talk much about it, from the work that we did previously, unfortunately it's still here, still taking lives, people of all ages, young and old, and we're going to continue to work hard to save as many people as we can. Sandra.
If I could ask an off-topic question, could you fill us in on where things stand as far as the Bills Stadium?
I'm not going to talk about bills today. This is too important. Thanks, everyone.